Welcome to our channel. Today we're diving into an important health topic that often flies under the radar: fatty liver disease. Now, you might be thinking, my liver? What's going on with that? Trust me, it's more common than you think. And it's crucial to understand. We're going to break it down in a way that's easy to grasp. So stay tuned as we explore what fatty liver disease is all about. We'll uncover its root causes, the things that silently contribute to its development. And don't worry, we won't just leave you with the problem. We'll equip you with knowledge about symptoms, diagnosis methods, and most importantly, the steps you can take to address it. Because knowledge is power, right? By understanding fatty liver disease, you're taking control of your health. Let's get started. So what exactly is fatty liver disease? In simple terms, it's a condition where there's an excessive buildup of fat in your liver. You see, our liver is like a superhero organ, working tirelessly to filter toxins, produce bile for digestion, and store energy. But when fat starts to accumulate, it can interfere with these vital functions. Now, there are two main types of fatty liver disease: alcoholic fatty liver disease and non-alcoholic fatty liver disease. Alcoholic fatty liver disease, as the name suggests, is linked to excessive alcohol consumption over a prolonged period. On the other hand, non-alcoholic fatty liver disease, or NAFLD, is not directly caused by alcohol. It's often associated with factors like obesity, insulin resistance, high cholesterol, and high triglycerides. Now, here's the thing. In the early stages, fatty liver disease might not show any noticeable symptoms. It's often a silent condition, which is why it's important to be aware of the risk factors. As it progresses, it can lead to inflammation and damage to the liver, a condition known as non-alcoholic steatohepatitis, or NASH. NASH is a more serious form of fatty liver disease and can progress to cirrhosis, liver failure, or even liver cancer. But don't worry, we'll delve deeper into those details later. The important takeaway here is that early detection and management are key to preventing serious complications. So stay tuned as we explore the root causes of fatty liver disease in the next section. Let's talk about what leads to a fatty liver. First up, we have obesity, a growing concern worldwide. When we carry excess weight, especially around our abdomen, it increases the likelihood of fat deposition in the liver. Next, we have insulin resistance, a condition where our cells don't respond properly to insulin, the hormone responsible for regulating blood sugar levels. This can lead to a buildup of fat in the liver. High cholesterol and high triglycerides, also known as dyslipidemia, are also significant contributors. These fatty substances in our blood can accumulate in the liver, increasing the risk of fatty liver disease. Excessive alcohol consumption, as we discussed earlier, is a direct pathway to alcoholic fatty liver disease. Over time, alcohol damages liver cells and disrupts its normal functioning. Beyond these major players, certain medications like corticosteroids and some chemotherapy drugs can also contribute to fatty liver disease. It's important to note that genetics can also play a role, making some individuals more susceptible to developing this condition. Other less common causes include rapid weight loss, malnutrition, and certain viral infections like hepatitis C. Understanding these root causes is crucial for prevention and early intervention. By addressing these risk factors through lifestyle modifications and medical management, we can significantly reduce the likelihood of developing fatty liver disease. One of the tricky things about fatty liver disease is that it often doesn't cause noticeable symptoms in its early stages. It can be a silent condition for years, even decades. However, as the condition progresses, certain signs and symptoms may start to surface. And one of the most common symptoms is fatigue, a feeling of persistent tiredness or lack of energy. You might find yourself feeling exhausted even after a good night's sleep or struggling to get through the day. Abdominal discomfort is another potential symptom. You might experience a dull, aching pain or a feeling of fullness in the upper right portion of your abdomen where your liver is located. As fatty liver disease progresses, it can lead to inflammation and swelling of the liver. This can cause jaundice, a condition characterized by a yellowing of the skin and the whites of the eyes. Other symptoms that may arise include loss of appetite, nausea, swelling in the legs and ankles, and itchy skin. It's important to note that these symptoms can also be indicative of other health conditions. So, if you experience any of these symptoms, it's crucial to consult with your doctor for a proper diagnosis. They will be able to assess your medical history, conduct a physical examination, and order the necessary tests to determine the underlying cause. Remember, early detection is key to effectively managing fatty liver disease and preventing further complications. Now let's talk about how doctors diagnose fatty liver disease. It often starts with a simple conversation about your medical history, lifestyle, and any symptoms you might be experiencing. During the physical exam, the doctor will gently press on your abdomen to check for liver enlargement or tenderness. Blood tests play a crucial role in assessing liver health. Elevated liver enzymes, such as AST and ALT, can indicate liver inflammation or damage. Imaging tests provide a visual representation of your liver, helping doctors assess its size, shape, and any structural abnormalities. An ultrasound is often the first imaging test performed, followed by more detailed scans like CT scans or MRI if necessary. In some cases, a liver biopsy may be recommended to confirm the diagnosis and determine the severity of the condition. During a liver biopsy, a small sample of liver tissue is extracted using a thin needle and examined under a microscope. This helps assess the degree of fat accumulation, inflammation, and scarring. The good news is that fatty liver disease is often detected during routine checkups or when investigating other health concerns. By diagnosing the condition early on, we can intervene and implement lifestyle changes or medical treatments to prevent further liver damage. The good news is that fatty liver disease is often reversible with appropriate lifestyle changes and medical management. The primary focus of treatment is addressing the underlying causes and reducing liver fat. One of the most effective ways to combat fatty liver disease is through weight loss. Losing even a small amount of weight, around 5 to 10% of your body weight, can significantly improve liver health. Regular exercise is crucial for shedding those extra pounds and improving insulin sensitivity. Aim for at least 150 minutes of moderate intensity aerobic activity or 75 minutes of vigorous intensity aerobic activity per week, along with muscle strengthening activities twice a week. A healthy, balanced diet is paramount. Focus on consuming whole, unprocessed foods, including fruits, vegetables, whole grains, and lean proteins. Limit your intake of saturated and trans fats, cholesterol, added sugars, and refined carbohydrates. If you have diabetes, managing your blood sugar levels is essential. Work closely with your doctor to adjust your medications and lifestyle as needed. In some cases, your doctor may recommend medications to address specific risk factors, such as high cholesterol or insulin resistance. It's important to note that these medications should be used in conjunction with lifestyle modifications and under the guidance of a healthcare professional. Remember, consistency is key when it comes to treating fatty liver disease. By adopting these healthy habits and working closely with your doctor, you can improve your liver health and prevent further complications. That was a deep dive into the world of fatty liver disease. We covered a lot of ground today, from understanding what it is to exploring its causes, recognizing the symptoms, and most importantly, the steps you can take to address it. Remember, knowledge is power when it comes to your health. By understanding fatty liver disease, you're empowered to make informed decisions about your lifestyle and seek timely medical attention if needed. If you found this video helpful, don't forget to give it a thumbs up and share it with your friends and family. Subscribe to our channel for more informative videos on health and wellness. Until next time, stay healthy.